to the AI Boost podcast. This is the show where we talk about healthcare leaders who are improving care, supporting workers, and building better system for every single day for our nurses. So today I'm excited to welcome Melissa. Melissa is a registered nurse, educator, and healthcare leader with over 20 years of experience. Melissa, can you please introduce yourself to my audience, please?
Yeah, so thank you very much for inviting me. And I've been a nurse for over almost 30 years, actually. And, in the beginning, I worked in pediatrics in the NICU and then transitioned to community-based home care, home health, and hospice, and really enjoyed that. But I felt like I lacked the ability to really impact systems and to impact care at a larger scale. Went into leadership and then ultimately into education, where I've been for the last 10 years. And I really love creating curriculum and products for frontline caregivers, certified nursing assistants, home health aides, and home care aides. And that's really been my passion, and what I've been doing over the last 10 years is just creating curriculum, training, and ways to increase the pipeline of those frontline caregiver roles.
Wow, thanks for sharing.
Yeah.
To start, can you tell us a little bit about your why you joined the workforce advocacy?
Yeah, so workforce advocacy, I am the executive director fractionally for the Commission for Nurse Reimbursement. And we are really looking at how to create a recognized billing structure for nurses so that our care would be reimbursed financially. And I started, it's kind of funny, I actually started because I was laid off. I had some extra time on my hands and started volunteering for the commission, and then realized that the alignment was really there, and ultimately ended up taking the executive director role. But I think advocacy is something that every nurse should be doing. Like, we should be using our voice to speak up, whether that is on the patient level, letting patients know like they have options, helping to make sure that their voices are heard. We should do it in our communities, whether that's at work, in your where you live, and then also state and nationally, to help people understand, the society at large, to understand what nurses do and what we need to really care for patients the way they deserve to be cared for.
Thank you for sharing that. It's clearly you've seen healthcare from many angles, and that experience really shaped the work you do today. So you work closely with direct care workers like nurses, aides, and home health workers. So what are some of the biggest challenges they are facing today?
Yeah, I think one of the biggest challenges, especially in training, is that they don't realize what the job is going to be, right? It's a hard job. They are not compensated very well, and it is physically and mentally exhausting. And so really getting them to understand what that work is, why it's important, why it matters, I think that is a really big barrier for them. And then also, I think another barrier is just them feeling supported. They go into nursing homes, they go into home health, they're in someone's home, they don't have immediate access to a nurse or a supervisor, and so they don't feel supported, even though what they're doing is extremely important. And we have to build those systems around them to ensure that they are getting the support, the education, the training that they really need to be successful.
That's so important. Staffing shortage, burnout, and lack of support affect not only workers but also patient care and outcomes. So, how does technology help improving education for the nursing workforce, and especially by implementing AI tools or AI in the
Yeah,
system?
I think technology, and I don't think that we in generally in healthcare are really good or have really embraced technology and AI in education. I think it's something that we have to continue to really embrace and think about how we use it. I know in my current role, we started using an AI tool with an avatar. So instead of me recording a lot of videos and standing in front of a camera, I now use AI and I have my own avatar. And so we're able to really create quality training very quickly. It just takes that friction out. I also use AI to do all of my research, a lot of my research, and some of like the outlines and starting to really develop. I think we need to be able to look at where AI can take the mental work out for us and really on the cognitive load, and then optimize that so that we can do our best work. And I think there's a lot more that we can do in education, especially for frontline caregivers, in using AI.
Wow, thank you for sharing that. But can you also share with my audience what kind of AI tools you use to make your video? At least
Yeah.
one. Mm-hmm.
Yeah, so Synthesia is what we've been using and what I use quite frequently. And so, I can create a video, I can create a script, I can create the video, I use an avatar, I bring in B-roll clips. So I can do all of that in one platform and generate that video in, what would have taken me 3 to 4 hours of work. Now, just myself, not including like post-production now, so that probably totally was more like 6 to 7 hours per video. Now I can do it in about an hour and a half. And so it really speeds that up. And then I like to use Claude when I'm writing rather than ChatGPT. It's much more conversational. And so that's another AI tool that I use.
Oh, sounds good. It sounds like you're a little bit advanced with AI. That's really, really great. I love that approach. When education is easier to access, more engaging, and build for real life work, it's helped people feel confident and prepared instead of overwhelmed. So you are also a strong voice for nursing reimbursement reforms. Why is it so important that nurses and direct care workers are valued financially and professionally?
Yeah, I think it is so important because historically, nurses have always been rolled into the room rate. And so what that means is that if you go into the hospital, and patients go to the hospital for nursing care, but yet when they get their bill, there's no line item for nursing. We are just part of that room, much like housekeeping. And so you think about all the things that a nurse does, and we never reimburse them, and we never reimburse the hospital for that nursing care. So there's not a revenue line item that then they use to invest back into the nursing workforce. So what ends up happening, because if you look at, we don't invest in costs in business. We invest in things that will help us make money. And so when a hospital has to tighten their budget, they often decrease the number of nurses that they have, increasing how many patients we must take care of in a shift. And then that increases or decreases job satisfaction for nurses. And so until we really recognize the economic power that nurses have, that we definitely help hospitals make money. That's why people come to the hospital. Until we can do that as a society and really change that reimbursement structure and billing structure, nursing will continue to be hidden from what we really do, and we will not be able to show our economic power.
Absolutely. So when nurses are valued, supported, and paid fairly, the entire healthcare system becomes stronger and more stable. I completely agree with that. But so thank you for sharing all that. And I think if we have any nurse listening to you today, so they definitely learning something new. So before we wrap up, what is one message you like healthcare leaders, organization, or policymakers to remember when it comes to supporting the nursing workforce?
I think the one thing I would say is that nursing, we make up the largest portion of the healthcare workforce, but we are not represented in rooms where decisions are made. And that needs to change because nurses understand they understand healthcare from the patient level. And when you understand that, you understand what levers that you can pull to change outcomes, to change revenue, to change impact. And that's what healthcare is about, is helping people to live their best lives and to be as healthy and well as possible. And so I would say, remember that we are the largest workforce, and we need to invest back into nurses.
Wow, thank you so much, Melissa. Your work is a powerful reminder that better education, better support, and better system leads to better care for everyone. So I really like the fact you show up today. Tell me some challenges. Are you currently working for yourself? Or you working at a company, for a company, or do you have your own business? How do you operate?
Yeah, so I work for a company. I also then, with the Commission for Nurse Reimbursement, I am a contractor for them. And then I'm also working on a kind of a stealth startup with a friend. So I've got a little bit of all three different types of jobs going on right now.
Wow, sounds good. Saying that I would like to keep in touch with you, see how we can help each other. How would you like that?
Yeah, that would be fantastic.
Sounds good. So, do you have any day and time next year? Maybe January we can reconnect and
Sure, that would be great.
Okay, sounds good. What I will do, I will send you my calendar. You can pick a time and a date that work for you, and we can reconnect. Thank you so much, Melissa, for joining us today. I really appreciate your time. Take care. Happy holiday. Bye-bye. Take care.